Hello. Mrs. Smith, good afternoon. I am Scott, the registered nurse. I will look after you this afternoon. How are you feeling now?
I feel worried. I have got a urinary tract infection and now I begin to take antibiotics. I wonder how long I need to take them and how long I will need to stay in hospital.
No worries. Urinary tract infection is a common complication after surgery, and your situation is not serious. You begin to take antibiotics, and they will control the infection while you need to take the medication for a course, about 7 days. So you will stay in hospital for the next 7 days, then we will test your urine again. If the result is negative, you will be able to go home. Is that clear?
And whether chemotherapy will be dangerous at my age, you know, I am 72-year-old.
I understand you are really worried. The chemotherapy is much easier to tolerate today even a few years ago. It is safe for people at your age. Although there are some side effects of chemotherapy, such as nausea, hair loss, fatigue, but it is quite individual and your doctors and nurses will keep close track of side effects and can treat most of them to improve the way you feel. Did your doctor tell you about your diagnosis?
No, nurse.
It is colon cancer. I am sorry about that. It would like to know how you feel about the last 6 months.
I had an episode of unconsciousness and I was not feeling well for a few months, lacking of energy and be tired quickly.
I am sorry to hear about that. What have you done?
I just lay on my bed and had a rest.
I see. Colon cancer may be resulted from an unhealthy diet, drinking, smoking and lack of exercise. So would you mind if I ask you some questions? How about your diet?
Like fast food, meat. I do not eat fruits and vegetables every day.
Do you smoke or drink?
Yes. I smoke.
Do you exercise regularly?
No.
I see. You need a healthy diet. You need to eat more vegetables, fruits and less meat. Because meat contains high fat and cholesterol, have been linked to increased colon cancer risk. High fiber food is healthy, such as wholemeal bread, fruits and green vegetables. Besides, I suggest you to give up smoking because they may transport carcinogens to the colon, so they increase your risk of colon cancer. In addition, a sedentary lifestyle can lead to colon cancer development. So I recommend that you would do exercise regularly. For example, you may have a walk around your house for 5 to 10 minutes every day.
Yes, nurse. Definitely I will follow your advice. But nurse, I am worried about my husband. I live with him, who has chronic obstructive airways disease and is partially blind and very reliant on me. Now I am in the hospital. He is at home alone. I am worried about him.
I see. No worries. I will give you some help. For example, Meals on Wheels. They offer 3 meals so that your husband does not have to cook by himself. And they will assign a carer to help him with housework, such as dressing, bathing, washing, cleaning, gardening, and things like that. The carer those support do shopping for him and chat with him. I will give you the numbers of carer also can do services. If you services you need anything else once you have been discharged, you can put can in place. These services also can help you a lot and you will have more time to rest. You need rest for full recovery. Remember, we are here ready for help. After you go back home, we will also keep an eye on you. You need a regular checkup. If you feel unwell, you need to see your GP. I suggest you to see your GP more often. Are you following me?
Yes, nurse. That would be great.
I have some booklets about colon cancer. If you are interested in them, I will bring them to you. Do you have any other questions?
No, nurse.
All right. Now I leave you to do something else. I will be back soon with those booklets. Here is the bell. Please do not hesitate to give a buzz if you need me. Remember, we are always here for help. See you later.
Thank you, nurse.